A new philanthropy, intent on reaching a standard of high performance, is created. In March of 2000, the Health Foundation of Central Massachusetts called for applications to address its ambitious new charge.
The mission of the Health Foundation is to improve the health and well-being of the citizens of Central Massachusetts, with particular emphasis on vulnerable populations.
With assets today of $60 million, the foundation was funded from the sale of Central Massachusetts Healthcare. The foundation's board has concentrated on a few health issues, granting a total of nearly $10 million.
In its first 5 years of grant making, the Health Foundation has focused on oral health improvement, children's mental health, and protecting children from abuse and neglect.
Through the Foundation's Healthcare and Health Promotion Synergy Initiative, $7.5 million have funded 4 multi-year collaborative projects.
We think it's critically important that the community decide what its greatest concerns are and that it has leadership in place to address those. So rather than the Health Foundation defining the kind of issues it wants to see addressed, we intend to wait for the community to make that decision and come to us.
The Synergy Initiative provides planning, pilot, and implementation grants. Each collaborative project implements public health and medical access strategies and secures changes in public policy.
The decision was made to fund multi-year projects and see them through until there was a systems change so that whatever evidence-based program had been put in place could be sustained forever and ever after the Health Foundation funding was no longer in place.
Special tax status allows the Health Foundation to lobby for policy change in addition to funding programs. The board recognized that the Foundation's capacity to lobby was just as important as its financial resources.
Most foundations tend to be scared silly of getting involved in policy. They're afraid they're going to offend somebody, they're afraid they're going to make some enemies, or that there's something dangerous involved in it. And the Health Foundation of Central Mass really stands out because it not only does not avoid the policy process, it runs toward it. It actively engages because it understands that constructive, positive, well-done policy engagement is actually one of the best ways to improve the lives, the health, and the well-being of large numbers of people.
In 2005, the board commissioned an evaluation of the Foundation's performance.
We commend the Health Foundation for its vision and its accomplishments in its first 5 years of grant making, and very importantly, for distinguishing its work and being in a select, small group of high-performing foundations who place their own performance firmly in mind and in behavior.
The Foundation invites you to share highlights from the evaluation report. Dental decay is caused by bacterial infection that can spread throughout the body, profoundly affecting physical health. Chronic oral infections are a leading cause of school absenteeism, as well as major health issues later in life, such as diabetes and heart disease. In Worcester County, some 35,000 children and 65,000 adults from low-income families have been unable to access dental care.
We can't volunteer enough to be able to solve the problem of access to care of dentistry. Systemic changes need to be made, and the Health Foundation has helped us to develop those systemic changes.
Responding to the oral health crisis, the Foundation granted $4.6 million to 2 grantees, the Central Massachusetts Oral Health Initiative and the Oral Health Initiative of North Central Massachusetts. The results? Great Brook Valley Health Center and Family Health Center of Worcester have doubled their dental services capacity. These health centers, working with the UMass Memorial Ronald McDonald Caremobile and Quinsigamond Community College Dental Hygiene Program, provides oral exams, cleanings, and fluoride treatments to children in Worcester, Webster, and Southbridge public schools. A dental residency program was established at UMass Medical School, only the 3rd medical school in the country to sponsor a dental residency.
Not only is it providing services to the needy, but it is also training future dentists to become exposed to the problem.
More results. 33 dentists joined the GAP program and accept reduced fees from low-wage earners.
Probably the most significant change that we were able to accomplish through this grant was the implementation of the dental service at the CHC Family Health Center in Fitchburg.
We have seen 13,850 patients. There are people who have not had access to care for so long that their needs are very, very great.
School children in Fitchburg, Leominster, Gardner, Winchendon, Phillipston, and Templeton receive preventive dental care. Another accomplishment resulted from a need identified by the region's dentists.
There's also an effort to establish a dental hygiene training program, and that was a project we supported through Mount Wachusett Community College, and they opened their hygiene training program this fall.
Both grantees participate in the statewide Oral Health Advocacy Task Force, coordinated by Health Care for All. Together, they have driven administrative and public policy changes such as restoration of MassHealth adult dental benefits for 45,000 pregnant women and new mothers, the executive branch's recommendation to outsource the administration of the MassHealth dental program, authorization for dentists to set their own MassHealth caseloads.
Caseload says that if I take one patient, I have to take all Medicaid patients that call my office.
So you really could end up with a dental practice being entirely MassHealth. And dentists object to that, and rightly so. And so the first thing that we had to do was remove that law from the books. It took us about 3 years, but we were able to do that this past year.
One major aspect of the Health Foundation of Central Massachusetts' approach to grant making is its strong focus on public policy and systems-level change necessary to sustain best practice interventions. From a community change perspective, this is where the most meaningful outcomes will occur.
Nearly 35,000 Massachusetts children are abused or neglected each year. These children could fill the stands of Fenway Park.
We link individuals together in the community that are working on this problem so that resources can be shared, so that support can be shared between the various providers and individuals that are involved in helping.
The collaborative developed the Family Outreach Network to help families at high risk for abuse and neglect. Here's one mother's story.
Different allegations were coming out from my daughter about mental abuse and physical abuse and sexual abuse. DSS investigated a situation and they contacted the Family Advocate Program. The program helped me to find counseling for everybody. My family is in the best place they've ever been. Because of the help we got from the program, we survived everything.
It's the responsibility of Fund and Connecting Families to connect those families up with whatever resources, whatever services they need in the community.
Initial results of the collaborative's data show promise. Families are experiencing positive change.
The collaborative has also addressed the increase in cases of shaken baby syndrome.
The children most at risk for physical abuse are the babies and the infants who cannot defend themselves. Most of the time it's somebody losing his or her temper. The child won't stop crying. And as parents are stressed and are tired, they can do something impulsively and wish that they hadn't.
The grant funds training at area birthing hospitals. The lesson for new parents: never shake a baby.
Oh, well, also for my husband or anyone who's watching her, because just so they know that the damage that can happen to her if they were to get really angry at her.
They go home and they make sure that their babies are safe and they know how to handle a crying baby. One of our moms said, "Can I bring my babysitter here?" And she actually brought her 14-year-old babysitter to the hospital to watch the film and to talk to the nurse.
I know that we will do what we can in terms of seeing this become reality as a statewide initiative. Take what we've learned in central Massachusetts and have it go statewide.
Massachusetts has the 9th highest rate of preschool expulsions in the country. The Together for Kids Coalition took aim at the problem.
There was a broad group who wanted to see something done to remedy that problem, to help children develop socially and emotionally so that they could be ready to enter school and be successful.
Kids were getting hurt, and consequently we were having to terminate children. The year before TFK began, we had terminated 7 children from our program.
More than 1 in 4 preschool students have behavioral issues that interfere with relationships and learning. Families like Shanique and her daughter Asia benefited from TFK.
She didn't really get along very well with her friends, and I think it's probably because she didn't have the right social skills. I've gotten a lot more experience and picked up some good skills and strategies and things I can do when certain behaviors come out.
Guys, make it together.
We need to look at the whole family, because it's not just at that age a child who can be fixed. It's truly the environment that child lives in and is nurtured in, whether it be home or the center or ultimately school.
If we can intervene when the children are very young, the intervention is much more cost-effective and can be short-term.
By facilitating resources, make those resources available to children at the youngest ages, I think we can hopefully foreclose the possibility that those children might have more serious issues later on in life.
TFK has demonstrated that with an average of 30 hours of consultation over 6 to 8 months at an estimated cost of $2,500, significant developmental gains can be achieved with improvements in the child's behavior.
I don't think that we would have gotten this far without TFK.
Activation Fund grants are intended to support initiatives that can be accomplished in a one-year time frame, that have discrete outcomes or results, and that improve health and support an organization's growth or development to a new level of capacity or service. In some cases, Activation Fund grants were used to help strengthen partnerships between organizations so that they could expand their capacity and ability to provide services and improve health.
The first Activation Fund grants was to Great Brook Valley Health Center, where funds were provided initially to help them create a dental lab. And once it was up and running, they were able to sustain the lab without outside funding.
Clearly, the payoff of these grants has been quite large. Modest amounts of funding have led to significant accomplishments.
I'd like to thank the physicians of Central Massachusetts, past and present Board of Directors, the Attorney General's Office, all the members of the not-for-profits that have worked with us for helping us and enabling us to reach this position 5 years after our birth.
The 5-year track record of the foundation ought to be a model for other community foundations across the country.
We pride ourselves in Worcester on public-private partnerships, and certainly what's been done in the area of oral health is just such an example, and we are grateful to the Health Foundation of Central Massachusetts for being part of, well, being the cement that holds it all together.
Foundation is very fortunate to have been able to work with hundreds and hundreds of individuals and nonprofit organizations on our board, in the community, in the legislature, in the administration of this state, and able to make change because of these people. We appreciate all that they have done, and we look forward to continuing to work with them in the years ahead.
The Health Foundation understands that its work will continuously evolve over the years as it seeks to fulfill its mission, a mission that, by its very nature, can never be fully accomplished. Making progress toward the mission will require its continuous investment, evaluation, and an emphasis on systems-level change.
We take our inspiration from the British poet Robert Browning, who wrote, "Ah, but a man's reach should exceed his grasp, or what's a heaven for?" We take pride in knowing that working together, we can bring a bit of heaven to our region.